Is it safe and what are the risks? This is really important. It is a very, very safe thing to have done. It's actually one of the safest procedures you can have done, and it's something that's done really, really frequently. Inevitably, almost all of us going to require it at some stage, so there really is nothing to worry about. There are certain people who are higher risk, and I will be doing videos about those higher risk people and the particular things that are important to them. But in the general population, the majority of people, it's not an issue and not a problem at all. There are obviously problems that can occur, and it's really important you know that. We say about 1 in 100 people can run into significant issues that could leave them with poor vision. 1 in 1,000 people can get infection or end up blind in that eye because of messing around with them. 1 in 10,000 people can lose the eye because of the operation. It all sounds scary, but you play the odds and the numbers are very, very low. There are some specific things that can happen. We inevitably introduce inflammation, and that's almost inevitable. We give you steroid drops to control that. Some people can get excessive or prolonged inflammation. Rarely when we try and take the lens out the front of the eye, the clear bag that holds it in place can split. There's about a 1 in 50 chance of that happening. If it does, then the jelly can come forward and cause issues, or even worse, the lens can fall to the back of the eye, which would require a second operation. Sometimes, because the bag that was supposed to hold our new lens isn't there anymore, we have to put the lens in a slightly different place, and that can cause minor issues. Really rarely, if it really is a major issue and there's no support for the lens, we can leave you without a lens, then you have to go back and have a second lens. Again, this is extremely unlikely. The retina can swell at the back of the eye, something called cystoid macular edema. It just becomes swollen, usually self-limiting, but sometimes it can be chronic. We have to treat it. Your cornea can swell. The cornea maintains a state of dehydration in order to maintain clarity. And sometimes, because of the energy we use inside the eye, or a predisposed or a previous problem with your endothelial cells, the cells that line the inner surface, your cornea can go cloudy. Usually it's self-limiting. Usually it gets better over sort of 6 to 8 weeks, but sometimes it can be permanent. The retina can come away. It's really important for people who are very short-sighted, because your retina is a bit thinner, and so it can come away. We don't fully know whether the cataract surgery causes the retina to come away or whether it is always going to happen, but it's really important to know that if you suddenly develop a halo of tadpole floaters, solid curtain across your peripheral vision and flashing lights, you need to report it straight away. So it's pretty safe to have done. The risks are really quite minimal, but they're not zero. You will get a bit of irritation, you will get a bit of dryness potentially. Sometimes you can have visual problems, particularly with the clever lenses. You can have problems with bright lights and things like that, but in most circumstances it's not an issue at all. There are certain special situations whereby you're at increased risk, such as a small pupil, a very dense cataract, or if you're on some special medications such as things for your bladder, but I'll discuss that in a slightly different talk. But most of all, it's fundamentally safe. 97 times out of 100 is smooth sailing. 2 out of 100 minor issues we can tweak and fix for you. 1 out of 100 bigger problems, sometimes requiring further operations, and sometimes we can't fix them. It is very unlikely, but it can happen, so you've got to go into it with open eyes, if you excuse the pun.